Welcome to the deep dive. We're getting right into it today.
We are.
We're looking at the strategic way Australian doctors are taught to assess kids who are struggling with behavior. We're pulling apart the framework they use for these really high-stakes medical exams, and the mission here is to extract one key idea for you: how to shift from, just diagnosing a symptom to really understanding the child in context.
And that shift is everything. It's the whole foundation. The core Australian model, they call it the biopsychosocial imperative.
Okay, biopsychosocial.
Yeah. It forces you to see the child as part of a whole ecosystem. You can't separate a diagnosis from their family, their school, any social stress they're under.
Right, it's all connected. Okay, let's unpack this and start with what the sources say is the absolute #1 priority: safety. And it sounds obvious, but they mean it goes way deeper than just physical danger.
Oh, much deeper. It's built on 3 critical pillars. The first one is medical safety. This is a big one. It's the absolute non-negotiable need to rule out organic mimics of a psychiatric disease.
Mimics, so physical things that look like mental health problems.
Exactly. You have to consider really serious things like frontal lobe tumors or even rare conditions like Wilson's disease. But, much more commonly, it's checking for things like obstructive sleep apnea.
Sleep apnea, how does that connect?
A child who can't breathe properly at night is exhausted and can't focus. It can look almost identical to ADHD, but it's a breathing problem, not a brain problem.
Wow. Okay. So that's medical safety. What's pillar 2?
That would be psychosocial safety. In Australia, mandatory reporting laws are very strict, so doctors are, in a way, legal sentinels. They are required by law to ask the hard questions about domestic violence, about potential neglect or abuse.
And to get people to even open up about that, the sources stress this patient-centered approach. I saw this line they recommend using. Something like, "That sounds incredibly exhausting for you."
Ooh, why is that phrase so powerful? It's more than just being nice. It's a clinical tool. It validates their struggle and instantly lowers that defensive wall. You build an alliance, which is crucial. And once you have that trust, you need to be efficient.
So you've established safety. How do you prioritize what comes next? What's the best first question?
It's what they call the agenda setting question. You just ask, what is your biggest worry right now?
Ah, so simple.
It is, but it cuts right through the noise. It reveals the parent's deepest fear. Maybe they're scared their child will be expelled, or that something is physically terribly wrong. That fear is the key to managing the whole conversation.
That makes so much sense. Okay, then you move to what the sources call the diagnostic sieve. It sounds like a mental checklist.
It is, and the order is what's fascinating. You have to follow a sequence. First, you look for organic causes. Check their hearing, their vision, simple stuff. Second, developmental delays in speech or motor skills. Third, psychosocial factors. Is there stress at home? A divorce? And only then, only at the very end, do you consider a formal psychiatric diagnosis.
So you check the hardware before you assume it's a software problem.
Perfectly put, yes.
And on that note, one specific tool I found really interesting was the 2-setting rule. You need to see symptoms in at least 2 different places, right? Like home and school, for something like ADHD.
Yes, that's critical.
So what does it signal if the child is only acting out at home?
It signals that it's probably not a pervasive neurodevelopmental disorder like ADHD. It's much more likely pointing towards something in the home environment, parenting, boundaries, that sort of thing. It's a hugely important differentiator.
Okay, so let's tie this to management. The sources use these great analogies to explain conditions to parents. For ADHD, they use the race car engine but bicycle brakes idea.
It's a brilliant analogy, and the stimulant medication in that analogy aims to tighten the brakes.
How does it do that biologically?
It increases dopamine activity, mainly in the prefrontal cortex. That's the part of the brain that handles inhibition and executive functions. You're literally helping the brain's braking system work better.
You're tightening the metaphorical brakes. Got it.
Precisely. And then if you look at something like autism spectrum disorder or ASD, the key in Australia is the National Disability Insurance Scheme, the NDIS.
The NDIS.
And specifically, there's a pathway called the ECEI, which is Early Childhood Early Intervention. The crucial part is that it allows kids to get help speech therapy, occupational therapy, based on a documented developmental delay. They don't have to wait years for a formal ASD diagnosis to get started.
That's huge, getting help early.
It's a game changer, and that leads to managing something like oppositional defiant disorder, or ODD. The cause there is often what we call the coercive cycle.
The coercive cycle?
Yeah, where a child escalates the behavior and keeps escalating until the parent just gives in to make it stop.
Which accidentally reinforces the bad behavior.
Exactly. So the management isn't about medicating the child, it's about breaking that cycle. You do that with evidence-based programs for parents like Triple P.
So when you put it all together, what does this framework really mean for you, the listener? The power here, I think, is in recognizing that a child's behavior is always communication, this whole structured process. It's about providing safety and clarity for the entire family.
And a final thought on that, even when a diagnosis isn't immediately clear, the most important thing you can do is pivot to function. How can we support this child at school right now? And just as importantly, what are they good at? Focus on their strengths.
Right. And that brings us to our final thought to leave you with. If something as common and reversible as otitis media, just a simple ear infection, can cause temporary hearing loss and make a child seem inattentive, it makes you wonder, how many behavioral struggles around the world are fundamentally rooted in simple, undiagnosed sensory issues? Something to mull over.